So Axie and I worked, as Dr. Stamer said, on evaluating the impact of early telehealth evaluations on diagnostic outcomes with Dr. Megan Talbot. I'm Angela Dahia. I recently graduated with my PhD in clinical psychology. And then Axie.
Hi, everyone. I'm Axie, and just as Aubin mentioned, I am a junior specialist or a research coordinator here at the Mind Institute with Dr. Nordahl in a medium-term training.
Axie and I both kind of had an interest in the TEDdy project, just really looking at, we've talked a little bit about already, like the importance of early diagnosis and early identification of autism. And so we kind of wanted to look into this project more to see what some of these early telehealth assessments are able to do for outcome purposes.
This is our disclaimer slide. All of the results and the content that we discuss is not endorsed or inferred by HRSA, HHS, or the US government. This is our presentation outline. So we're going to discuss some background about telehealth evaluations and early identification. We're going to delve a little bit more about what is the TEDdy project, what are the aims of the study, and then kind of share more about what we're looking at as a team and kind of the measures, the questions that we're asking, and some of our analyses, and then we'll do a discussion. So some background on kind of why we're interested in this and why is this important. There are a lot of barriers regarding routine screening and evaluation of autism spectrum disorders, ASD, in infancy. Specifically, there are not many screeners for infants younger than 12 months. And there's, even for the ones that are available, there's limited access to quality and specialized evaluation. And there are a lot of service gaps within minority and underserved populations. Telehealth evaluations, as many of you now know, as we've gone through the pandemic, can really increase access to the availability of being able to be seen by a professional provider. And it also increases access across geographic and clinical barriers. The TEDdy project is currently following infants with early concerns around 9 to 12 months over time and seeing how maybe these procedures or these evaluations early on, how they can predict maybe outcomes later on. So some of the primary aims of the TEDdy project is to assess the feasibility of TEDdy. And so TEDdy is a telehealth protocol that consists of parent measures and behavioral measures that are used through telehealth to kind of observe some infants and then also collect longitudinal data on these symptomatic infants over time. The data and the question that we're going to be addressing is really focusing on what do we know about these early symptomatic infants and how they've developed over time, and collecting that longitudinal data and being able to see where they are now, which will be at 30 months, and kind of compare that to when they were earlier in infancy. So like I said, because it's a telehealth measure, there's some behavioral assessment measures that are used via telehealth, and then also parent questionnaire measures that parents will report on. And all of these different measures are used to kind of assess where the infant is in their development. The main measure that we will be looking at is the AOC, the Autism Observation Scale for Infants, which the infants that were enrolled between 9 to 12 months, that is one of the measures that was used to kind of assess their development. And so this is kind of the full protocol of the TEDdy project. And so the infants that we collected, or that we will be looking at, and the data that we'll be understanding, it comes from the initial pilot and the feasibility study. So infants that had parent reported early concerns during infancy, about 9 to 12 months. And so we have their AOC scores at this time, and we will be looking to see whether there was a significance with their AOC scores to the follow-up study, which they are currently coming in for. We have about they're just starting this up, and these infants that came in during 9 to 12 months, they are now at 30 months. And so we're following up with a naive assessor to see if they have any autism diagnoses, or if they are now, or they don't have any diagnoses, and kind of continuing on to seeing their development over time and being able to follow them since kind of their early infancy period.
Like Axie mentioned, our kind of primary question based off of this data is whether or not the AOC scores on the AOC at infancy predict an autism diagnosis at 30 months. And so the AOC is kind of a behavioral observation measure. Prior to the pandemic, it was conducted in person, and following that, it's been done all over telehealth with an assessor kind of guiding the parents through the different tasks. And so we're looking at that scores, like we mentioned early on, and then seeing what their diagnosis was when they came back. So the kids that we saw, or that we looked at the data for, there was only 10 participants. We had 5 in the ASD outcome group who had a confirmed autism diagnosis at 30 months. And then we had a typically developing outcome group who did not meet for an ASD diagnosis. Surprisingly, we actually had more females than males in this population, which I know is not as common with a lot of autism research. And then we also had primarily white individuals with a few Asian families. So mostly white. In terms of education, some parents did not report education, but there was a good mix of families who had parents with a college or bachelor's degree, some with a graduate degree, and then there are also a good amount with some sort of vocational or technical degree. And then in terms of income, it actually varied. Half of the families did not report their income, but the other half, it was split between kind of this whole range of from as low as 25 to as high as 200. So a little bit of variability there. So again, with the sample size only being 10, we were kind of limited in how robust of a statistical analysis we could really do. So we ran an independent samples t-test to see if there were any significant differences between the two groups. And there wasn't, obviously, because it was smaller size, but you do see that in the autism group, the AOC mean score is higher than those in the typically developing. The cutoff score that on the AOC is a 7, and so you'll see that again, this was higher in this group than in the TD group, but actually in both groups, 80% of the participants actually met that 7 or above AOC cutoff. And so again, there's not really a lot you can really do again with just one measure. So Axie kind of showed all the different measures that are usually collected during a TEDI visit. And this kind of just tells us that we probably can't predict an autism diagnosis with just the AOC alone. It would be really important for us to collect all those other different measures and get a better picture of the child's presentation through all these other different assessments and interviews with the parents. Yeah, so it shows that, and I think the other piece to remember is those individuals who did come in for this assessment were presenting with some sort of concern about their child's development. So that also kind of explains a little bit of why the mean scores were a bit higher and why there were actually more that met that cutoff. So basically, kind of from what we've gathered, the strength is that TEDI does have this potential to provide more accessible assessment and evaluation options for individuals who are in other areas and are able to provide more of a telehealth evaluation. The fact that the study is on a longitudinal design allows for more consistent follow-up of the development to kind of see how the child develops over time. Of course, like I mentioned, our limitation is we did have a smaller sample size, and the diversity, like race, SES, was a bit limited as well. But the hope is that we can try to aim to recruit a more diverse sample and include participants from other rural or underserved areas. And we still are continuing the data collection for the follow-up study. So hopefully we'll get some more participants from the 30-month outcome visits to add to this data set. And as I mentioned before, just kind of thinking about moving forward is just collecting multiple assessments and interviews to get an accurate diagnostic prediction will be important. So although the AOC is a really good measure to use, it's still, again, the visits kind of might require more than just one observation. And then again, yeah, we'd like to thank Dr. Talbot, Dr. Dufek, and Dr. Young for letting us work on the study.
That was so interesting. Thank you very much. I'm so interested in that TEDdy cohort. I don't know if you'll know this or if Megan might, but I wondered, in the 5 children who didn't meet criteria for autism, did they have anything else going on, like a language delay or anything behaviorally or temperamentally that might help explain why their parents were early on worried? And secondly, did all of the parents accept that you didn't think that the child had autism, or were some of them still concerned or wondering, you know, if that diagnosis was correct or that non-diagnosis was correct?
Yeah, I think the first part, I think I remember there might have been a couple of kids that maybe had like a language or speech concern. I think in the 10, I don't know if there was, I want to say I saw someone with maybe an ADHD diagnosis, but for the most part, I think the others didn't have any diagnosis. I can't remember actually if you or again.
We had about maybe 13 kids who had some type of outcome diagnosis, and we excluded about 3 of them because they were either non-ASD or non-typically developing. So there were some other maybe developmental concern or some other diagnosis that they received during the 30 months. And then we also kind of discussed, after looking at this, is we don't know what services children received over time, or we weren't able to evaluate that. So I'm not quite sure what parents kind of what they felt once they kind of received some confirmation on the assessments that happened.
Yes, thank you. As some of you know, I am marginally involved in the TEDdy study. We have added a motor component. Actually, one of my LEND trainees started this project, Shannon Hoffman, and then it was carried out by Alicia Clark last year, and then I continued it this year. And we found quite a few motor delays or children scoring in the lower range, about half the children from all those videos, and it was pretty consistent over time. And also we made some clinical observations about tone. So I would be so highly curious if somehow if these are the same children that ended up receiving a diagnosis of autism, because it was about half the children that scored below the 25th percentile in their motor skills compared to typical development. So quite a high percentage of children, from my perspective, was definitely delayed and had low tone. So just food for thought.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.